Hi, my name is Biljana. I'm a registered massage therapist at Savannah Massage, and I would like to talk to you about a few information about the manual lymphatic drainage treatments.
Perfect. So question number one is, what is lymphatic drainage and how does it work?
Manual lymphatic drainage is a type of treatment where we manipulate the skin to promote faster flow of the lymphatic fluid that promotes faster drainage from the area. Usually it's done when there is a swelling in the area, and we want to promote faster so then it doesn't sit too long into one part of the body.
Okay, awesome. Question number two is, who can benefit from lymphatic drainage?
Any swelling conditions, so anything from injuries, broken bones, after surgeries, in case of burns, cancer patients, inflammatory conditions, so number of conditions where we can divide into huge groups. So one is where lymphatic system is healthy. So something else is causing increased demand on it, so it becomes overwhelmed. So that would be in case after surgeries, injuries, when there's swelling is temporary. But lymphatic system on its own is healthy, it's just overwhelmed on a temporary basis. Then we have conditions where lymphatic drainage is in trouble, and it is most common condition is lymphedema, where it's a condition that is chronic, progressive, and it needs management with lymphatic drainage. And it's actually the whole treatment of lymphedema. It's called complete decongestive therapy, which involves manual drainage, compression, exercise, and skincare. So those are two major groups where we can apply the manual lymph drainage.
Okay, perfect. What are some common signs that someone might need lymphatic drainage?
Swelling is the biggest one. Swelling that usually there's a reason for swelling. Congestive tissue, so in case, as I mentioned earlier, after surgeries, after injury, some congestive tissue conditions such as headaches or migraines or chronic sinus infections that the fluid lingers for too long in the area, so it needs to be drained faster, because lymphatic system has its own pulse, it moves on its own, but when it's overwhelmed, this is not enough. So then we with manipulation of the tissue, we promote faster movement of the tissue and better drainage.
Okay, awesome. How does this massage differ from a regular massage?
First, what people notice, or what our patient notices, is pressure. So it's very light pressure, it's skin depth pressure. It's rhythmic, it's directional, it's always toward the heart, toward the closest lymph nodes, or toward the heart. It is slow and rhythmic, it comes down the nervous system, and it's usually not done to the whole body, it's done to the specific area that we're treating.
Perfect. And are there any contradictions on people who shouldn't get this type of massage?
Yes. Any acute infection. So if somebody is sick, if somebody's on antibiotics, if there is open wounds or skin infections, also there's a systemic conditions such as congestive heart failure. So in case where you would have both legs swollen, when you have deep vein thrombosis, when you have kidney failure, so you don't want to move fluid toward these organs that are already in trouble. So you don't want to overwhelm the organs, and you can make the condition worse. Another thing is we don't treat acute infections, or when people are currently sick, not just because it's not going to improve, but it actually can make it worse. So it can spread the infection. So that's why that's a major contraindication. When somebody is sick on antibiotics, no manual lymph drainage.
Okay, awesome. That's all the questions we have for you today. Thank you so much.
Thank you very much.